Throughout time and across cultures, the arts have been essential to the human spirit. Music, words, color, and movement have been not only a source of enjoyment, but an instrument of health and healing.
What was new was not the concept of artists in the healthcare environment. What was so totally new was that somehow a whole field had begun to emerge over the last 20 or 30 years. It seemed such a natural for the University at Buffalo and for our community, for Buffalo, New York.
The University at Buffalo Center for the Arts introduces the first formal Arts in Healing program to Western New York. This new initiative has hired and trained 12 professional artists to work in local hospitals.
We're all human beings. We're all creative. We all have a sense of imagination, a sense of wonder. They really need that in a hospital environment to remember that they're not just a patient, they're not just an illness, that they are a whole human being.
UB's Arts in Healthcare program is a collaboration with Kaleida's Women and Children's Hospital and Roswell Park Cancer Institute.
Certainly the issues that we deal with at Children's are very serious and impact not just the patient, but their entire family. The moment Burrows pitched the idea to me, I knew that it made perfect sense for our patients and families at Children's.
When you're ill and you're injured, you're facing very difficult moments in life. It's very important to reach within yourself, to have a sense of hope, to have a sense of spiritual comfort. So I think having artists in residence really brings a dimension that I think adds to the overall healing of the individual. And it's particularly true, I think, on the pediatric side, where we're piloting that program.
Artists work in waiting rooms and treatment areas, as well as patient bedsides. The goal is to transform the healthcare environment and encourage physical and emotional well-being.
I'm working with a patient right now who loves to sing. The first time we met, it was just a party. I mean, we just sang song after song after song, everything from Coming Round the Mountain to Abba Dabba Honeymoon to, rock and roll songs. He just loves it all.
And their rooms become little art galleries. And the children are really proud of what they do. They do story writing, they do painting, they do drawing, they do dance, they do all different kinds of things. And they're very proud and they like to show you what they do.
It offers diversion, it offers opportunity for release, it offers the opportunity for self-expression, both for patients and their families. And that improves the quality of the experience for patients and their families. And I am confident, though it's a little harder to prove, that improvement also improves the overall outcome and ultimately survival for cancer patients.
A successful University of Florida program offered inspiration and guidance, and the John R. Oishei Foundation provided the funding to make the vision a reality.
Well, of all the requests that we get, this really had two significant points that caught our eye. Number one, it just really hit one of our sweet spots and our outcomes that we're looking for, and that's healthier residents. And number two, it's a model that works.
One of the most amazing days was when a little boy got so focused on his painting and describing this world that he was creating that when the nurse came in and said, is he ready for some pain medication? The dad said, no, he hasn't complained about anything. And then they whispered, I think it's the art.
This Center for the Arts program will be used by university researchers to further explore the connection between the arts and healing.
I did a little bit of background checking to see just what's been done, and this is an area that's definitely lacking and something that definitely needs to be explored and more research needs to be done so we can understand it better and hopefully down the road really utilize the arts in patient healing and healthcare practices.
I think this is a marvelous illustration of how new and creative ways of combining some of the fundamental units we have on the campus can result in very interesting, and in this case, I think very responsive initiatives for the benefit of the community. Once again, the university itself, its faculty, staff, and students benefit from these new ways of thinking about problems and using our resources, and the benefit is both inside and outside the university.
I feel very proud to be a part of this program. It's exciting to me to be here at the very beginning.
Although I've only been doing this work at Roswell Park for 5 or 6 weeks now, I feel like I've already learned so much about life, about myself. I've met so many fantastic people.
I've had some very powerful and life-altering experiences myself, some wonderful gifts that I've received from working with the patients.
As an artist, we're often alone. I'm writing a play, I want it to have an impact, but at the hospital, every patient in some way is affected by the art. And I feel like I'm sort of just bringing it. So it's just an honor really to bring this creative process to people and see how it changes them.